The Skincare Through the Ages series is sponsored by Neutrogena. To learn more about the products mentioned in the episodes, please visit the link in the description.
Hi, I'm Dr. Patty Ferris. I'm a board-certified dermatologist, and I'm your host for this episode of the Science of Skin podcast, formerly known as Skincare Confidential. As most of you know, this supports our medical meeting, the Science of Skin Summit. So our name change is really to align and to bring everything under the brand of the Science of Skin. So welcome to my guests. I'm going to introduce both of them for this episode. And this, by the way, is the second episode in a series about skincare through the ages that's sponsored by Neutrogena. And in this episode, we're going to be talking about skincare for teenagers. So I have literally the best possible experts could have been found in the world talking to me. So I'm so excited. First, let me introduce Dr. Katie Belesne. She's a board-certified dermatologist, boarded in both Canada and the U.S., currently practices in Vancouver, such a beautiful city, lucky you. She's on the faculty at the University of British Columbia. She's very active, does lots of clinical trials research, and has published more than 50 peer-reviewed articles and textbook chapters. Impressive. She enjoys educating about all things skin on social media, has a huge following. I'm a huge fan, and can be found on Instagram and TikTok at Dr. Katie Belesne. With me also is a good friend and colleague, Dr. Latanya Benjamin. She is double board certified. I love you overachievers. She's boarded in both dermatology and pediatrics. She's fellowship trained, a former professor at Stanford. She founded her practice down in Florida, which is called Young Skin. This is a private practice that's dedicated to specialized care and healing for all children with rare and common skin disorders. She's a well-known international expert on acne treatment, atopic dermatitis, and photoprotection and all things baby. She can be found on social media as Dr.Mommy on TikTok and drmommy.derm on Instagram. And I follow you too, and I love both of your content. So thank you guys for joining me.
Thank you. It's an honor to be here.
Yes, thank you so much. Love talking all these things. So
yes, this is right up your alley. And you know, this subject, skincare for teens, is so up your alley because, as you know, as all dermatologists know these days, with the advent and the rise in interest in social media, we have a whole new group of people coming into our offices going, what should I use on my skin? And they're kids, they're teenagers. Sometimes they're even younger than teenagers. And so let's start with your experience in your practice. Like, what are you both seeing? Latanya, I know you have a pediatric derm practice. Are you seeing more children in your practice with this type of question? And also, I want to know, what do their moms think?
Absolutely. Definitely over at least the past decade, we're seeing children younger and younger coming to talk about their skin with multiple skincare products. They're concerned about acne, and we're seeing acne actually arising earlier in life. So 8, 9 used to be unheard of when I began training as a pediatrician. Now, as a dermatologist, I'm seeing that is almost where we're at right now with the beginning discussions of skincare and hygiene. And the parents are absolutely shocked because they don't recall that their, menstrual cycle began, for example, at such a young age, or signs of acne developing a year or two before that occurs. And they're confused, especially with all these skincare products. They're really unsure of how to guide their young children.
I'm sure. And Katie, how about in your practice?
yeah, I mean, the same. I mean, I see a lot of parents asking about their kids and why their kids are getting all this skincare and into skincare. So I think that's a large part of the population I'm seeing. And then being online on social media, you see it like the Gen Z, the Gen Alpha, they're asking about skincare. They have so much more knowledge, I think, than previous generations. They're talking about ingredients and studies, and then they're looking at all the different skincare products that are available and engaging in them and buying them. So I think it's been a shift that I've certainly seen over, the past decade or so in practice.
It is a phenomenon. And for everybody listening, dermatologists are very well aware of this. There was actually an article in the Journal of Drugs and Dermatology, which we call the JDD, last month, about the, quote, Sephora kids, which is sort of an affectionate term for these kids who are just really have a heightened awareness about skincare. Now, we know, of course, that the skin of teenagers and even younger children is different than adult skin. So let's talk for just a second about maybe problems that could happen if these kids run into the wrong products.
Mm-hmm. Yeah, I mean, one thing we know with the teens and tweens, like they do have these pubertal hormones. They can be a little oilier, but they also have like that still maturing skin barrier. And so they're balancing different needs. But what's happening, that we're seeing a lot is they're out there, they're seeing all these products, they're online, they're being hit with all the TikTok trends. And sometimes I see issues with, for example, getting sucked into too many exfoliating products. They're on a whole whackload of things that they've purchased and trying to navigate that because their skin can be irritated or, undergoing a number of issues there. Also, we're seeing, for example, like the K-beauty stacks, they've got 10-step routines and they're teens and tweens, and or they've started anti-aging routines at really young ages where that might not be the right fit for their skin.
I don't think you can do anti-aging when you haven't aged, right?
Yeah.
that's
Precisely.
For sure a mistake.
Precisely.
But Tanya, what are your things that you're concerned about as a pediatrician and a dermatologist?
Similarly, yes, we could do damage to our barrier at any age. And just by virtue of having pediatric skin, they're really susceptible to what's out there. And this misinformation, or they're really being guided by older celebrities or folks that have that mature barrier. We're really at a disadvantage because they're starting younger and they can really wreak havoc in their skin much easier. And so we have to be mindful about educating the right ingredients in a particular product, not to do that damage to the barrier.
Yeah, absolutely. I mean, I think one of my favorite statements is like, let's make lemonade out of the lemons.
Mm-hmm.
So although there may be a little bit of lemon in this when we have to deal with these issues that may occur when they pick the wrong products, if they end up in our practices, we can give them good advice. And so let's talk first about what's a great regimen for a young person. What kinds of basics might you advise a patient to use?
Definitely the 3 pillars, right? We need to cleanse. This is a wonderful opportunity to talk about hygiene with the children, get them on an established skincare that can set them up for life. The basic pillars of cleansing, followed by moisturization and protecting the barrier with sunscreen.
Yeah. Absolutely agree. And, the one silver lining, I think, to the younger generation getting involved in skincare earlier is at least sunscreen and photo protection, as some people are more aware of that now, which is nice because, there's a little bit more. But I agree, talking about cleansing, moisturizing, and sunscreen is sort of that bare or basic level and can build on that depending on the needs of that kid or teen in front of you.
And young kids,
and I think,
pardon me.
Go ahead.
Oh, I was just saying, in young kids, taking advantage of the fact that we're teaching them younger can build consistency in their routine, confidence, some self-awareness, and really get them empowered as they're growing by taking this autonomy on the self. This is a great time. We have kids in this age that are learning to perhaps help mom or dad in the kitchen to cook. And there's ways to really, as you said, Dr. Ferris, turn this into a positive where we introduce this topic earlier in their life.
Yes, I love it. And, empowering them with self-care. And that's just so important. I think one of the things, let's talk about each of the pillars. I love that you called it that. Let's talk about cleansers. It's sometimes hard to pick cleansers in this group because you've got kids on all spectrums. You've got the oily acne prone patient. You've got the normal skin patient, and then you've probably got dry skin patients who have eczema. So what are some of the things that you might look for in a cleanser?
Yeah, I mean, I'm looking for something that's generally barrier friendly, pH balance, preferably fragrance free. And you can line it up to the skin type, right? So you might consider something more gel or foaming if they have more oily or acne prone skin, and something more maybe creamy or hydrating in terms of a cleanser if they're more sensitive or, eczema prone. So I think you can tailor it a little bit. Morning, I'm a little more flexible if they just wash with water or gentle cleanser. In the evening, certainly if they're wearing sunscreen or things through the day, they might get a good cleanse in. So those are some things that I would look for or suggest.
Yes.
And once I start seeing acne on the skin, even the microcomedones, the really, really small blackheads or whiteheads, this is the time to introduce a formulation that has anti-acne fighting properties. We want to make sure that the cleanser is non-comedogenic and is really going to start removing the excessive oil and dirt that may be present. but yet not do any damage to the barrier.
Those are all such great points. So I'm going to talk for just a second about 2 Neutrogena cleansers and let you guys weigh in on them. We'll start with acne because we were just chatting about that. Neutrogena oil-free acne wash has always been a favorite of mine. I've probably spilled that out of my mouth thousands of times in my career, and I'm way older than you ladies. But it is a dermatology favorite. And it's really a unique product because it does not affect the barrier. It's been studied. It's been shown not to increase transepidermal water loss, not to upregulate inflammatory markers. They've done a lot of really good preclinical work with it showing that it doesn't cause inflammation when compared to other salicylic acid cleansers. So this is a therapeutic cleanser. To take that testing a little bit further, they actually tested it on acne patients who used nothing but Neutrogena oil-free acne wash. And no surprise to me, but lo and behold, after 12 weeks, they saw an improvement in the acne with this cleanser alone. So this is kind of a two for one thing. Yes, it's a great cleanser and it doesn't impact the barrier because it has a special technology, which I'll go through in our next little discussion, but it has a technology that really delivers that sal acid deep into the follicle without irritation. But when you have kids and I hate to pick on boys, but we all know as dermatologists, do boys hate skincare products? Do they hate acne products? Do they use them? Usually not.
Right.
But if you can get them to wash their face, they come home from sports and they're sweaty and they're dirty and they've got to wash their face. This is a therapeutic cleanser. And so I've always loved it because it does have such great benefits for acne patients. And obviously there's lots of good acne products in the marketplace, over-the-counter products.
You're exactly right. That is such a win-win when you have the science meeting simple, practical use so that they can continue to use this on a daily basis and gain the efficacy and what they're there to see. They want those results.
Yeah, we want to see them too. Katie, I'll go back to your comment about barrier and something that doesn't disrupt the barrier. I think that's so important. There's some interesting research or market research that really shows that people like foaming cleansers. And I think they generally prefer something that foams. And a cleanser that Neutrogena has that I think is super popular for a lot of good reasons is HydraBoost Hydrating Gel Cleanser. And this is a non-comedogenic, fragrance-free, dye-free foaming cleanser. And I'm sure you guys have tried it because we all have. It's a lovely foaming cleanser. And what's interesting is that it has been tested in patients with both acne, sensitive skin, and with eczema. So it kind of bridges this whole group of teenagers that we see, as I mentioned early on, that spectrum of patients. What do you guys think about this cleanser? Have you all used it in your practice?
Yeah, I love this cleanser. As you say, it fits in with this. The foaming component to it, I think, makes it very usable and likable. But the fact that it is, in my experience with my patients, a bit hydrating, it doesn't feel like that stingy, dry component to it. But yet, because it's non-comedogenic, because it has that other property and how it feels on the skin, even my oilier or acne prone patients do so well with it. And it helps support the skin barrier at the same time. So I actually really love it for that sort of well-rounded cleanser that patient can kind of go to. And yes, the active cleanser is helpful to have on hand, especially if the acne is progressing and they're not using their topicals. But this one as a standard go-to is a really popular one in my hands and for my patients.
Yeah, I think it's popular with all dermatologists. They use a really interesting polymeric cleansing technology. And the surfactant, which is really the thing that can be so irritating, is a potato starch-based surfactant. And they add a polymer that sort of keeps that surfactant where it needs to be on the surface of the stratum corneum, doesn't allow it to penetrate deeper into the skin where surfactants can be irritating. So I think that's sort of the magic in this technology, that it really keeps it right where you need it to remove the dirt, the pollutants, and the makeup and everything else. But it's such a gentle cleanser. I really like this cleanser myself.
And gentle is key, right? We have kids that want to reach for scrubs. And so when you have a foaming cleanser where they actually feel like they're getting clean from it, they won't necessarily have to reach for those harsher astringents or facial scrubs. Again, minimizing their 10-step routine into something that's very high yield and effective.
Yes, I agree. And it's so important, I think, to, again, if they see a dermatologist, to get this kind of guidance so they don't get the wrong thing. Moisturizers are the second pillar. So let's talk about them. How do you choose moisturizers for teens and tweens? I mean, there's so much out there about things that are, I call them the villains in skincare, these things that are, they tell you shouldn't use, especially in children. So maybe LaTanya weigh in as a pediatric dermatologist. Where do you sort of stand on moisturizers and how do you pick them?
Absolutely. First, I want to educate the patients. We all need moisturizers. Even if you feel that you have oily skin, you really still need to hydrate your skin. And so I'm looking for a hydrating ingredients that most all skin types can handle very well, such as like a hyaluronic acid, right? You're going to reap the benefits of the moisturization from the hyaluronic acid, but suitable for most skin types, if not all, especially on a routine daily basis. So I think moisturization is especially key for the children to know that that's part of their routine.
Such a great point. They think they have oily skin and they don't need a moisturizer, but we know our acne patients have barrier dysfunction. They need moisturizers.
Absolutely.
Yeah, it's funny that myth is so perpetuated, and hopefully the social media will break that one, because I think anyone with acne is very prone to can't use a moisturizer, must strip, exfoliate, right? So really educating around that barrier support and the need to incorporate that as part of their regular routine.
And with that concern heard, the dermatologist then can offer something that's more lightweight or quickly absorbing, so they don't feel that we didn't hear that they're concerned about that part of it.
The Skincare Through the Ages series is sponsored by Neutrogena. For over 90 years, Neutrogena has advanced skin health for all skin types. With formulation expertise that combines scientifically proven ingredients and innovative technologies to deliver maximum efficacy and an unparalleled aesthetics experience. That's beauty to a science. To learn more about the products mentioned in the episodes, please visit the link in the description.
So there are two Hydro Boost products that I think are really important to know. We have the Hydro Boost Water Cream and we have the Hydro Boost Gel Cream. And I always get these names confused, so I have to read those out. But we're going to focus on the gel cream because this is probably more appropriate for this group of patients. And this has also been tested in sensitive skin, atopic dermatitis, and in acne. And it does eliminate a lot of the things that we like to see out of products. It is non-comedogenic, which is great. It is also dye and paraben free. It doesn't have any phthalates, and it contains hyaluronic acid. And one of the things that I like is that they did a study, what we call an adjunct study, and you guys know what I mean. How does it work as an adjunct to prescription medications? And they looked at the gel cream, and they found that when patients were using medications like tretinoin and Epiduo, that their skin at the end of 4 weeks actually looked better. Their skin was more radiant. The tone was better. You can see some of the before and after pictures are really impressive. Significant lightening and post-inflammatory hyperpigmentation. So talk a little bit about how in your practice you use these products, moisturizers, as adjuncts to our prescription products and what's important about that.
Yeah, I mean, I think we know that when you pair it with your prescription product, it can help with tolerability, right? A lot of the times, especially if you're using more active ingredients or prescription-based ingredients or topicals for acne, it can affect that skin barrier. So to find a moisturizer, something, and I do use a lot of the Hydro Boost gel cream in my practice that will help with the tolerability, yet also feels lightweight enough that people will use and not, there's that issue with compliance as we talked about. And if it's too thick or they're concerned that that's contributing to acne, sometimes they'll hold off on the moisturizer. So finding something that pairs nicely and supports the results of your active treatments or prescription treatments is really effective, I think.
Agree. And we do know that a lot of our acne medicines, particularly prescription ones, do affect the barrier, making a good moisturizer even more important for these patients. The last pillar, of course, is sun protection. And boy, we've got so many great sunscreens out there. So go ahead and dish, ladies. What are some of the things that you look for and what are your favorites? Do you like sticks for kids? Do you prefer creamy ones? What do you feel about sprays? I'll let you start, LaTanya, on how do you pick these products for kids?
Absolutely. First thing, I need to get them to use them. And that's what most of the parents ask me, to get them
Good
to
luck. That
actually
is
use
tough.
it. Yes. And I
So
have to
tough.
speak to Skin of Color. You know, there's still that perpetual myth. Well, if I have darker pigmentation in my skin, I may not even need a sunscreen. Yet we know that's a population that's prone to these acne marks at the end, the hyperpigmentation, the stubborn spots that they really want to clear. And so that's a nice introduction to say, hey, if you have acne, you may be at risk for dark marks after. So let's get a sunscreen on board, one that you're going to love to put on. And of course, with Skin and Color, you want to be able to massage it or rub it to the point that you have this invisibility, right? This shield that weighs in nicely without a cast. And so, you know, I think Neutrogena has beautiful ones to offer where you have this invisibility at the end as far as no pigment cast. And then they get that protection. But sometimes it's that introduction of why they're using sunscreen, not necessarily to fight skin cancer, which of course it does, and we need it to, but in the young population, they're more prone to what's real for them. And I think it's a dyspigmentation or is a way to go, as opposed to this is preventing skin cancers later down the road.
Yeah, so true. And you make such a great point about Skin of Color. I know one of the sunscreens that I think really works well in this group is Neutrogena Ultra Sheer Mineral Face Liquid Sunscreen SPF 70. This is a relatively new one. And I had the opportunity to look at this and to actually talk about it on another podcast. And what's interesting is it gives you greater UVA protection. So that is important for our patients that are prone to post-inflammatory hyperpigmentation, like our Skin of Color patients. This is a mineral sunscreen, as I said. And I think we see that movement away from chemical sunscreens towards mineral sunscreens in all groups, but a lot in kids. And the other nice thing about it was when they looked at it in patients with Skin of Color, it had 30% less of that sort of whitened cast that we see that's so uncosmetically acceptable, not cosmetically acceptable in our darker skin patients. So I think that this is a good sunscreen, probably for all groups, but certainly for patients that have the darker skin tones, and also have that being prone to post-inflammatory hyperpigmentation. UVA protection is a real bugaboo, as we all know.
Yeah.
Getting adequate protection is super important.
And I love that you introduced the concept of a sunscreen that is mineral based for the kids, because usually that's my go-to. I don't even get into the blends or the chemical based ones. For the kids, I know that's going to be tolerated. Most of my kids may have two conditions going on. They're trying to outgrow their eczema, but they still have very sensitive eczema prone skin while they're going through puberty and maturation. And now acne is a secondary thing. So still always being mindful about how sensitive pediatric skin is. I'm always needing a good mineral based sunscreen.
Yeah. Do you tend to lean towards mineral as well, Katie?
Yeah, I would say definitely in the younger kid population, as we talk about, just for that sensitive or eczema prone skin, I do find it helpful. I would say for my teen or older patient who maybe darker skin phototype and just hasn't found the right, I'm open to the, what works for them. And as we say, the best sunscreen is the one you'll actually use. And so I really encourage that kid or family, whoever it is in front of me, to find one that they will use. And like, there was a time we talked about sticks when my kids were young, and it was like the fighting with the lotion. And I was like, I got my stick sunscreen. And I'm like, you're like, I got it on at least for this moment. And like, that's a win. Right.
Yeah,
and
so true. They're such a moving target, right?
You got to do what you got to do. I'm like, so I think
So
really
true.
what you can get on is important. And then I think, I try to aim for that at least SPF 30 or higher, broad spectrum, as we talked about. And then the other key point, especially with, kids and teens in the summer, is if they're swimming a lot, look for something water resistant and like remind them about reapplying, or try to find something that, that they're at least knowledgeable that if they're out swimming all day, that they may be not as protected after the end of that course of swimming in the day.
So true. I had the opportunity to interview Josh Williams, who's a researcher and helps formulate products for Neutrogena. And he formulates sunscreen. He's a photobiologist. So I interviewed him on the podcast a couple months back. And he's talked to me about sunscreens. And they're so hard to formulate because there's so many things, as you point out. Yeah. Are they water resistant? Do they stay on all day? What are the patient preferences? There's so many factors that go into them. And if you look actually at the Neutrogena line, they have so many sunscreens. And they have many sunscreens for kids, sticks, sprays, and then other sunscreens that are certainly appropriate, as this mineral SPF 70 is. So there's just so many things that go into it. As dermatologists, I think probably don't appreciate sometimes the challenges that they have formulating things like this. And I know sunscreens are really hard.
Yeah.
A lot of small companies stay away from sunscreens because they're so hard to formulate.
Sometimes I give them a pro tip for the parents to get them to wear it and reapply by using 2 formulations. So I'll have, for example, the cream that you like as the one where they have a little bit more time in the morning or before they go for school, and they can put that on a nice good layer that's effective. But then when they're actually out, very active, kids, you want to keep it fun, keep them autonomous, they can get the stick and reapply. So if they're after school or it's beyond that time,
genius.
and they, parents don't have to worry about, I always hear the boys, since we're picking on boys, that they hate to that they hate to reapply because, for example, if they're playing baseball, their hands get all grimy.
That's so
and they don't
true.
want to use the
And they're
creams.
slippery.
Exactly.
Yeah.
Which is understandable. So just really understanding the patient and their needs and their preferences. I like them to go out fully armored and then reapply with the sticks. It may not be perfect, but it's something. So again, if they have after school activities or just to get them in the habit that reapplication is still part of the game here.
Right. And that's such a good idea. I love that idea.
Spray on the body too.
Yeah,
you can spray the body for fast, so
I
it's
know,
not
I agree.
in the face, aerosolized, and then sticks on the face. And the kids can do it.
Face.
Keep it fun for the kids. They don't mind doing that.
I agree. Anything they'll do, you're right. The best sunscreen's the one you can get someone to use.
Yep.
So I want to finish by talking about sort of a niche product that's wildly popular, again, as a result of social media, and that's these acne patches. So where do you guys stand on this, Katie? I know you've probably posted about it several times.
It's funny. When it first came out, I was like, where are we going with this, right? Because it's not like what we had traditionally learned or taught around, putting something all over for prevention, turning over the skin cells, right? Like as we would talk about with the retinoid, etc. Right. Spot treatment is not what we do. But I am a fan overall now in that I think it is useful in a few ways, right? It occludes the spot. It can wick away a little bit of that fluid. It blocks picking, which especially in the teen, tween, like it's so tempting. It's there, the picking. We see a lot of acne excoriae or excoriated acne lesions, which means they picked at it. And so I do think that is helpful to prevent some of that post-inflammatory change, potential scarring. And now, like, you'll see it, teens, they're like wearing them like badges of honor.
Like proud. Exactly.
Oh, I know. Like, what is happening? Like, everyone's just wearing them. And I'm like, well,
let's just normalize this. Could we just normalize it? I think it's so cool. So many kids have acne and it can be so stressful.
Right. And so this is something that feels like they're doing something. It's active. So I'm on board with it. And I think there's a role for sure.
I agree. I'm sure you use them as well, LaTanya.
I absolutely love them, especially the non-medicated ones, because it's really that hydrocolloid that's going to promote faster healing. So if they did get at something, we're going to try and minimize the scarring, really discourage the touching and picking that we just spoke about, which is huge. Yes. And again, the psychosocial component, you're right. I find in my practice that there's kids that the younger generation that are really... The heck is my hand? Sorry. The younger generation. Okay. The younger generation.
Coloring with the kids today in the office.
I'm bringing the office home. The younger generations that wear proud and, proudly, but there's still pimple patches out there that are really nice where if you want a discreet coverage where it's more tan complected, and those are lovely because the older kids don't necessarily want to have these colorful shapes all over their face.
No.
And I love when there's a variety of sizes that Neutrogena has for say, where you can think about it. We do still get back acne. So for larger areas, or if you need a smaller discreet, so the different sizes are helpful, if you have a small blemish on your nose. But I absolutely love them. You can have fun with them and they really do the job well. And, this is where I have the conversation with the preteens, the teens that, acne, I just normalize it that we have acne because for the majority, they're going through healthy pubertal changes. And this is not about being perfect. Social media drives this, perhaps flawless skin. We need to be perfect. We can't have a blemish. And so this says, blemishes, breakouts are normal. And we can manage it, and we can protect your skin while it's healing. And again, a lot of those pickers I see are the type A students, the ones that are driven for perfection, the ones that really get really good grades. I can't tell you how many times when I hear that they're picking or scratching, I'm like, oh, I bet you get great grades, you're straight A's. And they're like, yes. So I think these definitely have a role in our management for acne.
I think so too. I agree with you. The Neutrogena patches with the 2 sizes makes it really nice. And they did some nice little studies with it, as they always do. And 8 out of 10 kids said that they weren't picking because they were using the hydrocolloid patches. Yeah, I mean, that's probably the best thing that they do. They also do reduce the lesion itself, as you know, fairly quickly because they're occlusive. But just to stop these kids from excoriating. And you're right. I mean, these poor children who are looking for perfection. I mean, I tell my grandkids, I'm like, that's a filter, guys. These people have filters on. Everybody in your classroom, look around your room, and everybody has a couple little pimples just like you do.
That's why they love Snapchat. I think that's like the intro, because they love the filters. It's so fun, it gets them in that.
It is fun. And look, I'm going to finish by commending you two for all your education. I mean, I'm going to bow to you because social media to me is just like a thing I can't even wrap my arms around. It's so much work. And you guys do such great things. And it's so important that we have dermatologists on these platforms to dispel the myths, to give professional information, to help the moms and the grandmoms, because I get a lot of, questions. I do. I'm kind of a cool grandmom because I'm a dermatologist, and my grandkids are all little Sephora kids. They love skincare. They used to want to go to get frozen yogurt. Now they want to go to Sephora. I mean, it's so
you're the go-to person.
Oh,
they love you.
Totally. I'm the go-to and I'm the pay-to. So this is an expensive little thing that's happened, by the way. Allowance is no such thing as spending your allowance anymore. It's called grandparents. But anyway, it's a great time of life. I'm enjoying my grandkids tremendously. But this is a whole new phenomenon that we as dermatologists have to wrap our arms around. We have to, again, make it an educational opportunity where we can teach parents how to deal with this, what products to let their kids use, what products they need to have their kids use, and then to teach the kids about self-care and all these great products that we talked about. So I can't thank you guys enough. I was so excited about this all day because I knew it was just going to be a great episode. The two perfect people, and I can't wait to see you guys along the road. We'll be at a meeting together soon, I'm sure.
The Skincare Through the Ages series is sponsored by Neutrogena. For over 90 years, Neutrogena has advanced skin health for all skin types. With formulation expertise that combines scientifically proven ingredients and innovative technologies to deliver maximum efficacy and an unparalleled aesthetics experience. That's beauty to a science. To learn more about the products mentioned in the episodes, please visit the link in the description.